Bismillahirrahmanirrahim. This presentation is regarding Omentum. And what I mean by Omentum is greater Omentum, which is also known as policeman of the abdomen. Now, what I'll try to cover in this presentation is about omental anatomy, its function, and some of the clinical conditions affecting omentum. Now, let's start with the omental anatomy. What is it and what it appears like on examination, gross examination. So I got the specimen over here. This is greater omentum. It's fatty tissue and very vascular. Quite substantial by way of gross specimen, and this is a better picture of omentum. It's like an apron hanging from stomach and going down into the pelvis. It contains fatty tissues as well as a large amount of blood vessels, very vascularized. Now, to start with the anatomy, I'll show you it on a plastic model. This is a plastic model, and what you see here is the stomach. That is the fundus of the stomach, body of the stomach, and pylorus and antrum of the stomach, and this is the duodenum. Now this is lesser curvature of the stomach, and this is greater curvature of the stomach. Omentum has got two parts. One is known as lesser omentum and the other one is greater omentum. Our focus of attention in this presentation is greater omentum. But for the purpose of teaching and for the purpose of clear conception, I'll cover the lesser omentum as well as the greater omentum. The lesser omentum is along the lesser curvature of the stomach, and the greater omentum is along the greater curvature of the stomach. The lesser omentum extends from the undersurface of the liver to the lesser curvature of the stomach. It's a fold of visceral peritoneum. The visceral peritoneum extends from the undersurface of the liver and goes into the duodenum and the lesser curvature of the stomach. The part of the lesser omentum which extends from the undersurface of the liver to the duodenum is known as hepatoduodenal ligament, and the part of the lesser omentum which extends from the liver to the lesser curvature of the stomach is known as hepatogastric ligament. The liver is not shown here. This is diaphragm. So you have to imagine being liver over here and the lesser omentum extending from undersurface of the liver to the lesser curvature and the duodenum. Now I come to the greater omentum. Greater omentum extends from the greater curvature of the stomach, fold of visceral peritoneum, goes into the pelvis, and then it turns back, folds back, and ascends and gets attached to the transverse colon. Now here you see a part of the greater omentum over here. This is greater omentum. Half of the greater omentum is shown over here. And number of blood vessels, very well vascularized. The other half is not shown here. And it is in front of the small gut. It covers the whole of the small gut. So it is lying anteriorly in the abdomen, just beneath the abdominal muscles. It covers the small intestine in front and it's lying anteriorly. Now I'll try to explain this more in a longitudinal section for the purpose of teaching. Now this is a longitudinal section of the abdomen where peritoneal reflections are shown. Peritoneum has got two layers. One is the parietal layer which covers the abdominal wall. This is the parietal layer of the peritoneum. And the visceral layer which covers the viscera. The lesser omentum is the fold of peritoneum from under surface of the liver to the lesser curvature. This is lesser omentum. And the greater omentum is fold of peritoneum, visceral peritoneum from the greater curvature descending into the lower part of the abdomen, and it can go further lower down into the pelvis and then ascending up and covering the transverse colon. So this is greater omentum. So greater omentum has got two layers of visceral peritoneum. The space behind the stomach and behind the lesser omentum is known as lesser sac. And the space, general space in the abdominal cavity is known as greater sac. This is greater sac. The two has got a communication by way of a foramen over here, which is known as foramen of Winslow, epiploic foramina. Now this greater omentum is lying in front of the intestine and just beneath the abdominal wall muscles. And there is a fluid over here, peritoneal fluid, which helps for lubrication of the intestinal movements and the omental movements. So this is the description of the greater omentum. Now I come to the functions of the greater omentum. So just to revise anatomy, the omental anatomy has got lesser and greater omentum. These are visceral folds of peritoneum. The lesser has got two parts, hepatoduodenal ligament and hepatogastric ligaments extending from the liver to the duodenum and stomach. And more important is greater omentum. Greater one extends from the greater curvature of the stomach, goes into the pelvis and turns back, folds back and ascends to the transverse colon. And this is known as gastrocolic omentum. Now I come to the functions of the Omentum. Omentum has got a number of functions. Number one, you can appreciate that it is lying in front of the intestine, just beneath the abdominal wall muscles. And it is a fatty apron. So what it does is it acts as a shock absorber, and it is covering the intestine and gives support to the viscera. So it prevents from external injury impinging, impacting the internal organs. Number two, it is a fatty tissue, so it acts as a reservoir for adipose tissues. Visceral fat, it's an energy source, is a reservoir. And number three, it's immune response. It has got milky spots which detects the pathogens and arrests them. So it also acts as an immune response to catch the pathogens and arrest them in the omentum. The one more important property of the omentum is it is very vascular, and it promotes wound healing. So you can take a part of the omentum, segment of the omentum, and cover certain defects or promote wound healing where there is continuous difficulty in wound healing. So because it is very vascular. For instance, there is a perforated duodenal ulcer. Now, in surgery, when you see perforated duodenal ulcer, you suture the perforation to close the gap, and then you take a piece of the omentum and cover it over the perforation. So that promotes healing. The other important function of omentum is it acts as a policeman. It's very mobile, and because of its mobility, it can go wherever there is a problem in the abdomen. For instance, there is acute inflammation of the appendix, or the appendix has perforated, and the contents of the appendicular lumen is leaking out into the peritoneum. Now, being a good, efficient policeman, the omentum will go into the right iliac fossa and wrap itself around the appendix and try to control the damage. So it localizes the infection and prevents infection spreading into the rest of the abdomen. So it forms a localized lump in the right iliac fossa or a localized abscess in the right iliac fossa, preventing more fatal generalized peritonitis and generalized infection in the abdomen. So these are the important functions of the omentum. Number one, acting as a shock absorber, preventing external injuries going inside the abdomen. Number two, as a fat reserve for adipose tissues. Number three, playing a part of immunity because of the milky spots which can arrest the pathogens. And number four, omentoplasty, where you can use a part of the segment of the omentum to cover a defect. And Last important is policeman, localizing the infection, trying to control the damage before it spreads. So these are very important functions of the omentum. Now I come to the clinical condition. Now the clinical conditions, number one is omental cake. What is omental cake? Omental cake is thickened omentum due to infiltration of the chronic inflammatory cells or even cancer cells. The omentum becomes very thick, nodular, because of its infiltration by chronic inflammatory cells or even tumor cells. So that is omental cake. I'll show you a histological picture of the omental cake before I finish this presentation. Then you got omentectomy. Omentectomy is removing the omentum. Now this usually is done in cases of like carcinoma ovaries or endometrial carcinoma, where there is fear of cancer spreading into the omentum. So when you are doing a primary surgery for ovarian cancer or endometrial cancer, you take the opportunity of removing the omentum as well to prevent metastasis. That is omentectomy. Then omental infarction. Omental infarction is cutting off the blood supply to the omentum. Now this can happen during a torsion of the omentum. Because omentum is mobile, it may undergo a torsion and a part of the omental blood supply may cut off and omental infarction can happen. Very rare indeed. And omentoplasty, which I mentioned earlier on, take a segment of the omentum. It promotes wound healing. It forms new blood vessels. So you can take a part of it and use it to fill up a defect or wherever there is a problem with wound healing. Now before I finish, I'll show you the histological picture of an omental cake. Now this is omentum, fatty tissue. And here you got granuloma. This is tuberculous granuloma. And you can see a number of giant cells. Over here, over here, over here, over here. These are Langerhans giant cells. This omentum was removed when I was doing a gallbladder surgery. When I was doing a gallbladder surgery, there were gallstones, multiple gallstones, and some of them in common bile duct. But at the same time, the omentum was very, very nodular. And I thought this may be malignancy, very nodular, very thickened, like an omental cake. And I had removed a part of the omentum for histology, and that turned out to be tuberculosis. So this female patient had not only had gallstones in the gallbladder, in the common bile duct, but also had concomitant tuberculosis. So here I end. Thank you very much.